Hey there, I'm Kenny Pailes, a paramedic with the City of Austin, assigned to Austin-Travis County EMS's mental health response team, which we call the CHP Responders. We are super happy and proud this year to be partnering with the Hi How Are You project on their Happy HABIT-A-THON and support them in their mission to destigmatize mental health through meaningful conversation, which really is a perfect fit. I know you're probably wondering why it's a perfect fit, and maybe you're wondering why a paramedic is talking to you about mental health. And I'll tell you real quick that EMS really isn't just about taking people to a hospital as fast as we can in an ambulance anymore. It's about much more than that. We've progressed to the point now where it's our goal to bring the right care to the right patient in the right place and the right moment. And that means that we bring more than just traditional thoughts of emergency medicine or concepts of emergency medicine. Most importantly, we recognize that mental health care is healthcare. So as healthcare providers, if somebody calls 911 and their crisis is a mental health crisis, we're going to send paramedics. We're also going to send, of course, licensed clinical social workers and counselors from our mental health authority and other partners in public safety that respond to 911 calls. But as paramedics, what we bring is medicine. We bring our years of clinical experience and judgment. And of course, we bring a patient-centered approach to somebody in crisis. But the tool that we use most often, and maybe the tool that I think is most powerful, isn't a big secret. It's just having a conversation. Starting off with a single question and then compassionately listening, giving somebody space to communicate, to connect, to let me know where they are. That is, in my experience, really powerful medicine. And it's a key to doing my job. But the Happy HABIT-A-THON isn't about mental health crises, and it's not about making you into a responder. It's about creating regular habits that can really help. And having a conversation is a habit that you can build too, because by regularly practicing conversations with people, you are actually normalizing something and destigmatizing something that gives people the ability to have a conversation about their mental health. And if the time comes, maybe when they need help and they need someone like me, you've given them that comfort and ability and connection that they need to reach out for help. And that's why having a conversation is so powerful. You know, it's also kind of a 2-for-1 deal, because not only are you helping them, in my experience, having a conversation with somebody is a really good way to feel good myself. So it's kind of a 2-for-1 deal. And that's why I'm pretty happy that we got picked to share what I think is the happiest of all the habits, starting a conversation. And I'll tell you, it's not as hard as it seems. It really isn't. It just takes some patience, maybe a little bit of courage, but it is definitely within your ability to have a conversation with somebody, to reach out and make a connection. You should try it today. Just find a friend and ask them, "Hi, how are you?" And believe what they tell you.
Try it today. Check in with anyone at all. Just ask, "Hi, how are you?"
Hi, how are you?
Try it today. Check in with a neighbor. Just say, "Hi, how are you?"
Hi, how are you?
Hi, how are you?
Try it today. Check in with a loved one and ask them, "Hi, how are you?"
Try it today. Check in with a classmate. Just ask them, "Hi, how are you?"
With everything going on in the world, the pandemic, these last 2 years, mental health is really important. Take time to check on your family and friends and your coworkers. Simply just start the conversation. Hi, how are you doing?
Hi, how are you? Hi, how are you?
Hi, how are you?
Hi, how are you?